Okay, we have enough time for one more question, and then we have to close this webinar. And I'm going to read this one. What are your favorite anti-inflammatory herbs? Well, we're going to go over herbs in detail in the next webinar, actually, so this is a good transition. But and we're going to go over a lot more herbs than just anti-inflammatory herbs. But there are so many herbs that have anti-inflammatory qualities. It's hard to pick favorites, but I have some. I love Devil's Claw. I take Devil's Claw. It's very popular in Germany, in France. That's from South Africa. It's a strong anti-inflammatory. It's what I utilize. I don't utilize anything else as an anti-inflammatory right now. Not to say there's no other good things to use, but it's just what I choose. There's turmeric. I think that's great. My grandmother used that for her rheumatoid. It was pretty much the only thing she could tolerate. There is ginger root, which is one of my favorite things to use, period. Just love ginger root. Both the last two are tasty, by the way. There's willow bark, white willow bark, which was the original aspirin, if you will. That's what Bayer found out about it working real well, and decided to synthesize aspirin. And Feverfew, I use for some headache patients, things like that. I don't use Feverfew that much, but I love it because it was coming out in the first AD, and it does seem to help with some people for preventative in migraine. And those are the 5 that I probably would pick as my favorites. But there's so many. There's especially a lot that have mixed effects. You have so many herbs that have multiple effects, and they're synergistic, and they help people with pain. And we're going to discuss them in much more detail in the webinar that's coming up. That's just about herbs. So, and in fact, we're doing a series of 2 webinars on just herbs. So, all right. Well, thanks for being here today, and I'll see you at the next webinar.